So welcome everybody to this session, which we hope is going to stimulate some discussion and some questions. I've got 4 wonderful speakers here to join me, and we are going to have each speaker come on one by one, and we are then going to have a panel discussion at the end of the session. So if I can ask you all to please write down your questions, think about your questions, and we're going to have plenty opportunity, we hope, at the end of the 4 presentations to have some discussion. So just as a very brief introduction to the focus of our session today, over the last 10 years, I think we've made dramatic progress in terms of developing guidelines for care in Huntington's disease. You know, we've had some wonderful EHDN working groups coming together and really thinking about how we best set standards for guidelines. But I think it's fair to say that despite these guidelines, many of which are now published and shared, and that perhaps we don't necessarily focus on some of the more challenging conversations or situations in clinical practice. And so what we are focusing on in this session is really those more challenging topics that actually we all know are there. We all know that we face some of these more challenging situations and clinical decision makings, but actually nobody really writes about them or focuses on what we can do to move forward. So I'm going to start by introducing Ruth, our first speaker. Ruth is an MD and an elderly care physician based in Atlanta in the Netherlands. Atlanta is a specialized nursing home for Huntington's disease, and Ruth leads the multidisciplinary coordinated treatment and care for ambulatory HD patients and their families in the outpatient department. And besides her work as a doctor in these 2 groups, she's a research coordinator at Amsterdam University Medical Center, and her research focus is on HD. So if I'm going to ask Ruth to come up as our first speaker.
Thank you, Monica, for this nice introduction. And I thank the EHDN for giving us the opportunity to share with you our challenges in HD care. I think this can be very short because Monica introduced me already. And here you see our Atlanta teaching nursing home in the rural area of the Netherlands. And we've got 64 inpatients and 135 outpatients in an outpatient department. Today I would like to discuss with you how we deal with dilemmas in our institution, and because we use this method quite a lot of time and when we face challenges, and challenges are there all day, and dilemmas are defined as in general are characterized by a choice between excluding options, neither of which is satisfactory, because there will always be a form of moral damage. And we face them quite a lot. We choose every day in all kinds of things that come on. I would like to ask you, who of you is working with HD families in daily care? And if you do, please stand up. Well, I think quite a lot. And the next question is, who of you has dealt with a dilemma over the last year in the treatment or care for HD families? Almost the same, I guess. So it's very usual for us to all have dilemmas which we struggle with, and sometimes we even struggle with the patient. And I was looking in the literature, was there any evidence for HD dilemmas and how to deal with them? And I found out there are some studies on ethical issues concerning genetic testing, but that's not actually our subject today because we're beyond that genetic testing. And there are a few studies on suicidal ideation and assisted suicide. And that's about all there is on dealing with ethical or moral dilemmas. I would like to illustrate my talk with a case story of Mr. B. And he is a former DJ, and alcohol use was very normal in his life. In 2017, he was diagnosed with HD, and during that time, he had a few admissions in psychiatry and one in a rehab clinic for his alcohol problem. In 2019, he was admitted to our nursing home, and he had no problems with alcohol at that time, but he was just sitting in his house, not being social anymore due to his HD problems. And in 2022, this February, there was an aggression incident on our ward with Mr. B in a drunken state. And then we had a dilemma. And I would like to illustrate his case for how we deal with this on the ward. And we use the moral case deliberation. And this is a method where you do a conversation with all participants in this dilemma and jointly discuss this ethical issue from our work. It's a structured discussion with the help of a trained moderator, and it's about 1.5 or 2 hours of discussion. On moral case deliberation, there is evidence, and it's interesting that it was found out that using moral case deliberation adds to the proficiency of healthcare professionals, it adds to professional collaboration and to the quality of care. Well, who doesn't want to have that? There are 6 phases in this moral case deliberation, and I just introduced them to you, and that'll be my introduction of this session. The moderator introduces the session, the moral case deliberation, by some housekeeping points, that there is confidentiality and that people should dialogue instead of debate. So there must be sincere doubt about your own input and sincere listening to others in the team. And the practical experience, for instance, for Mr. B, this was this aggression incident, is the starting point. And the dialogue is the way and the end point. The second phase is that one of the participants presents the case. And it's the facts of the case, so what happened, and the experience and emotions that's coming with the case. And after a presentation, then we're going to formulate the moral question. What do we need to do? For instance, in Mr. B's case, do we have to prohibit him to use alcohol or not? And the third phase is the phase in which we verbalize the different perspectives of the participants. And for instance, I've mentioned here 3, but there are lots more. Mr. B doesn't see any problem. He was a DJ, so it's normal for him to use alcohol, and yes, he was aggressive, and he will never do that again, he says to me. He's always very helpful when I say I really have a problem. But the family says, well, he's got HD, so we have to give him quality of life, and alcohol should not be prohibited. The multidisciplinary team, which includes also the nursing staff in our team, aims for safety for themselves, but for their fellow residents as well. And they want to do the good thing, the right thing. The fourth phase is the phase in which we verbalize the norms and values. And values are at stake here are, for instance, autonomy. Mr. B wants to do what he wants to do because he just is normal. He doesn't have any problems. And quality of life is a value, and it has, of course, different perspectives, because his fellow residents were freaked out from his aggression, and the nursing staff was having a real hard time. So, and the nursing staff wants quality of life for all, and they don't want the quality of life, diminish the quality of life of others. So that's a real problem. Safety, people want to be safe at work, and dignity, they want to respect the patient well. All these kinds of values and norms we're going to verbalize and exchange with each other. And the fifth phase is making a decision. We dialogue on the differences and arguments for the different perspectives in this problem, and then we are going to find out where are we now. And actually it was very funny that we sat there and everyone had to give his own perspective and choose where am I on this alcohol ruler. Am I here because I want to prohibit him, or am I for the quality of life of this person? And actually the nurses preferred to give the perspective of Mr. B, to be his advocate. And it was interesting for me to see that it's so normal for a nurse to just give that perspective that they don't even think about themselves sometimes. They sort of choose. And in this last phase, then we're going to say, what are we going to do, and how will we evaluate it? It's not a way of saying we have the right solution for all your problems, but it's a way of dealing with trying to increase our proficiency, our professional collaboration, and our quality of care. Thank you.